Before we turn to tonight's discussion, I would like to share a poem by this great Irish woman, Pam Ayres. And the name of the poem is, Oh, I Wish I'd Looked After Me Teeth. Oh, I wish I had looked after me teeth and spotted the perils beneath, all the toffees I chewed and the sweet sticky food. Oh, I wish I'd looked after me teeth. I wish I'd been that much more willin' when I had more tooth there than fillin' to pass up gobstoppers from respect to me choppers and to buy something else with me chillins. When I think of the lollies I licked and the licorice also I picked, sorbet dabs, big and little, all that hard peanut brittle, my conscience gets horribly pricked. My mother, she told me no end, if you got a tooth, you got a friend. I was young then and careless. My toothbrush was hairless. I never had much time to spend. Oh, I showed them the toothpaste all right. I flashed it about late at night, but up and down brushing and poking and fussing didn't seem worth the time. I could bite. If I'd known I was paving the way to cavities, caps, and decay, the murders of fillings, injections, and drillings, I'd have thrown all me sorbet away. So I lay in the old dentist's chair, and I gaze up his nose in despair, and his drill it do whine in these molars of mine. 2 amalgams, he'll say, for in there. How I laughed at my mother's false teeth as they foamed in the waters beneath. But now comes the reckoning. It's me they are beckoning. Oh, I wish I'd looked after me teeth. Well, good evening, Nashville. Dentistry is the topic for tonight's discussion. According to the World Health Organization, WHO, dentistry is the branch of the art and science of healing concerned with the region, its associated structures, and the hard and soft tissues of the mouth. Dentistry is one of the oldest of the healing arts and one of the most modern of the healing sciences. There are 8 specialties recognized by the American Dental Association. One of those specialties is the orthodontist, and tonight's guest is an orthodontist. Tonight we will be discussing oral health and general well-being and how the mouth is the gateway to general health. Tonight we have, as our guest, Dr. Elijah R. Richardson. He got his DDS from Meharry Medical College in 1955. He got his master's degree and completed residency in orthodontics at the University of Illinois, the Medical Center in Chicago. He obtained his PhD in Human Growth and Development from the University of Michigan in Ann Arbor, Michigan. Dr. Richardson was a faculty member at Meharry for many years, where he rose to a full tenured professor, the chairman of the Department of Orthodontics, and eventually the dean of that dental school. He has published extensively and has presented papers all over the world. In 1981, he was named by Ebony as being one of the 100 most influential African Americans in the United States. Dr. Richardson will be interviewed tonight by our host, Mrs. Erica Battle.
Dr. Richardson, thank you so much for being on the program this evening, but I must ask, what type of dentist are you?
Well, I'm an orthodontist. That's a dentist who specializes in, most people think of it as the alignment of teeth.
Braces?
Braces, yes.
Okay, so I just recently had a guest on, and he talked about Invisalign. Do you use Invisalign, or do you just use the traditional braces? What's your technique?
Well, I don't do much work in the Invisalign area. I use it occasionally, but most of my treatment is done with what was introduced as the latest and greatest, which is commonly called the edgewise approach, the multi-banded approach.
the multi-banded approach.
Yes.
Explain that to me. I'm familiar with that.
Well, it is an approach where you use either bands or brackets in order to attach all of the teeth, and you're able to move teeth individually or move them collectively in order to try to put them in the position where they should be. The teeth, nature did a fantastic job in constructing the teeth, because those teeth are there's a bony socket, and the teeth are hung from that bony socket by a ligament which surrounds the root of the tooth, and that ligament is sensitive enough where I can take ounces of force and move the teeth around, but still it is powerful enough wherein the teeth can put more force. I think most people have figured that 150 to 200 pounds per square inch of force on the tooth, and the teeth remain in place.
Wow, I never knew that.
And so that ligament it's a very sophisticated ligament. Okay, the ossicles of the ear are formed as part of the jaw of the mandible, and embryologically, and they just drift into the inner ear, which gives you a natural connection of the oral cavity to the inner ear, which is so important in our balance when we stand up and also in hearing.
So what you're saying is the mouth is basically the gateway to the rest of the body. But what I also heard you mention was how so many things are connected from your head down, including your heart. So how does heart disease function kind of go hand with periodontal disease? Or for those of us that don't know exactly what periodontal disease that is the disease of the gums.
Yes, there's an extensive literature on that particular problem. Quite a bit of research has been done, and what you do find out is a very strong connection between heart problems and the state of your gums. As we know, the heart forms right in the under the lower jaw, and then it migrates down to the mediastinum in the upper part of the chest. Well, when it goes there, it certainly takes that vagus nerve down, and also the blood vessels, and they are the fascial sheets that go down with the heart, leaves an open pathway for bacteria that might be in the gums or your gingival crest to flow down to the heart and allows the bacteria to infect either the aorta of the heart or some of the valves of the heart, and vice versa.
I've never known that. As many times as I've gone to the dentist and have had my teeth cleaned and just being told to make sure that you do A, B, or C, floss, brush, and rinse, I never knew that I was really not only protecting my mouth, but I was also protecting, oh my goodness, I was also protecting my heart. Go, Erica. Yes. I never knew that. So what would you say to those persons who feel like, well, I really don't need to go to the dentist. I go get my physicals, every quarter like I'm asked to by my doctor, but they have neglected their oral health. What would you say to those persons to really, to let them know you really need to go to the dentist?
Well, it is very important, because nature set things up so that the mouth is the first barrier against the entry of organisms that should not come into the body. And if you don't go to the dentist, and if you don't keep that mucosa intact, then you break down the barriers that keep bacteria and viruses and rickettsia and everything else from going down into the body. If you have that barrier in place, then the mucosa of the mouth, along with the antibacterial activity of the saliva, you are able to keep those bacteria from going down and attacking some of the other vital organs in the body.
Okay. Now, in plain language, the mucosa, you referred to that a couple of times. What is that?
Well, that's the mucosa. That's the skin inside the mouth.
Okay.
Right, including your gums.
Okay.
Right,
So the mucosa as well as the saliva has some type of antibacterial fighting agents?
Yes, saliva does have antibacterial activity, and it does a fantastic job in helping to eliminate some substances that would attack the body because it will not let them get in.
Okay, so what about those persons who do not take care of their teeth? They don't brush regularly. They do have cavities within their mouth, and it is painful, but of course, they feel like, which pain should I endure more? The pain of the cavities, or do I feel like really going to the dentist and having this shot in my mouth? Not only do the cavities hurt them, but how does that affect their eating habits?
Well, most of your foods that you should be eating need to be chewed, and the mouth was set up in order to initiate digestion, because it grinds up the food and then it mixes the food up with saliva, and the saliva has some enzymes in it that particularly start to breaking down the carbohydrates. And if you don't have your mouth in condition where you will chew, then persons have a tendency to eat foods where you basically put it in the mouth, roll it around with your tongue, and swallow it. And of course, when you do that, most time you end up taking on too many of your sweets, too many calories, and the body takes on more than it can burn up in order to maintain equilibrium, so the person starts to become overweight or fat.
So you're saying that, I hate to admit it, but I ate a honey bun for breakfast this morning, but that's not my normal breakfast. Now, you're not talking about the person who occasionally partakes in those type of snacks, but you're talking about the person who, instead of, because that's not my normal breakfast, normally I would eat something like a parfait and some oatmeal with some fruit in it. So you're saying that the person who has something going on with their mouth, granola might not be the snack of choice, because you really have to chew granola, and it might hurt their mouth. But not only that, when we talk about, because the first thing I thought about when you said that was broccoli, one of my favorite vegetables. But unless you cook broccoli too long, it's supposed to be kind of crunchy to maintain those nutrients. So the person who is having trouble with their mouth, they might not want to partake in the broccoli. You're saying that they would rather eat something like French fries, like a McDonald's fry, because all you gotta do is kind of put in your mouth and just roll it around and just kind of keep it moving.
Yes, any kind of French fry has too much grease in it. A lot of research was done, for instance, on potatoes, and what they proved was